So thank you for being accommodating. I have to get on the train to get my little girl from daycare. But Bill asked me to comment on the last panel, and I just wanted to highlight what I saw as sort of 5 major themes that came across that are somewhat consistent with the work that I do. So I'm an associate professor at Johns Hopkins Bloomberg School of Public Health and do a lot of work looking at physician practice patterns in the healthcare system. And so I think the first, and there are 5 themes I wanted to mention. The first is that the team-based approach is really critical. I think we'd be naive if we said the solution to obesity lies with primary care physicians. They play a really important role, but so do dietitians, so do nurses. And so thinking about, what is the optimal mix for getting these other health professionals involved is going to be really important, particularly because, as Ryan mentioned, doctors don't have a lot of time when it comes to caring for patients. And so if they have to squeeze in this obesity prevention towards the end, it's reasonable that they can't do a good job to actually get the patients the care that they need. And then as Bill mentioned, a lot of doctors don't know the right language to use when talking to patients. And so if you can get professionals that are better trained, that have more time, it can actually go a long way in helping. The second theme, which was really highlighted in the Power Up and Yes We Can studies, is how do you actually link the environment with the clinical setting? And so if you're trying to give a patient advice and you have no real sense of where they live, it's hard to give advice that's very useful. So some of the more innovative studies are using GIS mapping to say, this is what a neighborhood looks like where a patient lives, and then using that to inform the sort of counseling that a nurse or a dietitian or a primary care doctor can actually provide. And in that way, it's possible to make the clinical encounter much more effective and applicable to the lives in which people really live. The third theme is the differing perspectives. And what I mean by that is it's so often the case that a patient feels like they're working really, really hard, but they're not showing progress because they're not losing weight, or they're not maintaining their weight. And so from the physician perspective, they're not working hard. In our own work, we've shown there's a huge disconnect there. So you have a patient saying, I'm trying so hard to lose weight, I'm trying so hard to be physically active and change my diet, but the weight is remaining stable or increasing. And so from the doc's perspective, well, you're not doing anything. And that mismatch can be very, very discouraging for patients and may actually contribute to some of the stigma that we're seeing quite a bit within the health profession towards patients and then from patients towards their doctors. The fourth piece, which I think is critical for the low-income and minority populations, is how do we leverage technology? And we heard this particularly in the Power Up study. But I think we have to make interventions consistent with people's lives. So if it means that texting, as we heard from Power Up, is how you meet parents, then that's what you need to do. In the clinical setting, as Bill was saying, about half of pediatric visits, you don't take a kid's BMI. And so you can imagine if you just had a scale that a kid would step on, or an adult would step on, and it would calculate both BMI and then where they fall within the weight trajectory, that little piece of information could then be tied into EMRs, electronic medical records, and they can say, give the patient these 3 pieces of advice based on their obesity risk profile. Because what we know is that even some residents, if you give them the actual BMI number, they're not connecting that that's actually overweight or obese, and they're not then giving the advice that the patients need to hear. And the final thing I would say is the sustainability issue, because we can have all the good ideas in the world, but if they don't last, it's really not that meaningful. And so I think to create sustainability, 2 of the things that we heard were you have to really have communication between the people that you're trying to reach and then the intervention that you're trying to implement. So if you don't understand what the patient population needs, it's very, very hard to do a good job. So that's point number 1. But then point number 2 is, within the world of obesity, there are so many stakeholders, particularly for an issue that is so expensive. And so any change to the status quo, you have potentially a lot of winners and losers. So the key, I think, to sustainability is finding that sweet spot where even if you have 2 groups that have different objectives, they can meet in the middle somewhere. And if you can find that sweet spot, I think that can do a lot in sort of pushing interventions forward. So I'll stop there, and I appreciate you guys being accommodating, and thank you for a great panel.
Those of you who don't know Sarah's work should read it, because she's one of the few people doing really excellent work in the whole approaches to obesity from medical systems perspective. So thank you, Sarah.